Year after year, literally millions of people endure the misery and agony of living with chronic pain as their hopes of ever getting better slowly diminish with each failing procedure. Up until now, most people living with pain thought that their options for treating their condition were limited to taking potentially harmful, habit-forming drugs that do little to actually solve the problem, undergoing usually quite painful injections or procedures that try to numb or deaden the nerve, going through invasive, often radical surgery that requires weeks or months of recovery time with no guarantee of success, or, tragically, just resigning themselves to living with the pain forever. Until now, nearly a decade of experience has led Dr. Ben Jakob to the development of treatment protocols that have changed the lives of hundreds of chronic pain sufferers for the better. This is not a one-size-fits-all solution, but rather the unique combination of various new, innovative, and distinct methods to produce results that otherwise would not likely be possible. Each patient is closely evaluated by Dr. Jakob, and a custom-made treatment plan is formulated to attain maximum results. The combined methods may include manual spinal decompression, computerized spinal decompression, low-level laser, ambulatory traction, various cutting-edge soft tissue techniques, proprietary taping methods, and much more. Stay tuned for the rest of this fascinating documentary to learn how you can get back to the life you used to have and deserve to get back.
Hi, I'm George Mitchell, former special agent, ex-police officer, serving U.S. military. About 10 years ago, I had lower back pain in my legs, and I couldn't walk or sit or even sleep properly.
Life was miserable. The pain that I had going down my back, Doc, was like a hot sword sticking down my left leg from my back almost to my ankle. I could not get myself dressed. I could not tie a pair of shoes. I could not put socks on. I could not get out of bed. I could not do simple chores around my home, like cutting the lawn, picking up the twigs that branches drop off, taking the trash out for my wife, washing dishes. I could not do these things. And I could not shoot pool, and I do enjoy shooting pool.
I was in tremendous back pain and discomfort, was not able to even work due to the weight of my gun belt. Most normal activities caused excruciating pain.
I was in misery, I had pain, I had a hard time working, and I could not sleep. And that was probably the biggest problem.
I had a herniated disc that was pressing on the nerve. It was giving me a tingling sensation down my right leg, burning in my right buttocks.
I was in so much pain. It finally hurt to stand, walk. I couldn't even move without being in intense pain.
What I'm finding with many patients who are dealing with pain on a consistent basis is that they simply don't know all of the valuable options available to them on a non-surgical level. After 10 years of practice, I'm constantly being told by satisfied patients that they wished they would have known that all of the options were available to them prior to having been treated with modalities that simply don't help their cause. Mr. Mitchell, what were you told were your only options for the treatment of your disabling pain?
Surgery, the injections, the cortisone injections, and pain medication. They were pretty much the only options that I was told by my doctor.
They will never tell you about any kind of alternative treatments. It's surgery first, or pain medication, or a needle in this, and it's just a Band-Aid. It doesn't address the problem.
Dr. Sadovnik, there are plenty of patients who are currently undergoing spinal epidural injections as well as spinal surgery. Being a prominent primary care physician here in Baltimore, what are your thoughts on that?
Well, spinal epidural injections works sometimes. Sometimes it works temporarily, and sometimes it really does not work. They have to give a second injection or a third injection, and then you realize the patient continues to have pain. Now, surgery is the last resort for us to recommend. We should finish all the other options we have available, the conventional methods and the other new systems and methods for example, you offer. We have to remember surgery has complications. And those complications could be really, really problematic for the future of the patient. Sometimes surgery is needed, and there's no doubt about it. But we should not think of surgery as our first resort. We should get anything possible, like all the systems you offer, to take care of the pain.
Dr. Sadovnik, if the statistics are correct, 1 in every 6 Americans suffers with pain at least 3 times per week. Some people even suffer daily. Why do you think it's so that so many people are suffering for so long without any help to be found?
A lot of people are suffering with pain because we're only using conventional methods to treat pain. Unfortunately, these methods are really not the solution for them. There's a lot of innovative systems and methods that are available now that patients and physicians, we are not aware of them. And that's the reason I send patients to you.
My doctor had me on Percocets, I believe they were, painkillers. Told me I needed to go to surgery. I couldn't take the painkillers no more because I was living on painkillers to the point where I thought I was getting addicted to them. I couldn't do anything without my wife's help.
He was on pain medicine all of the time, and he was out of work for nearly a year, and that was a very difficult time for us. That was very hard to go through that.
I was unable to get relief through normal physical therapy treatments, which I had been in approximately 3 months prior to coming to Dr. Jakob.
I talked to 2 surgeons about the pain, and they suggested that I have a fusion of my lower back, and that scared me out of my wits, and I decided not to have that type of surgery.
Why resign to living with pain, taking drugs endlessly, or having surgery when so many wonderful treatment options are so readily available?
We have been through so much, and I mean with the financial part of it, just the physical part with Mike. I don't want to take away from his pain. I know he was hurting. I was hurting as well. It was just physically, emotionally, mentally draining. We thought we had no other hope but surgery. And then I saw your commercial on television, and I woke my husband up in the middle of the night. Actually, I think he was still awake, and I said to him, "You have to try this Dr. Ben Jakob, and he does the spinal decompression. It's worth a shot."
Spinal decompression therapy involves a mild traction force which aims to reduce the pressure within the discs of the spine so that more space can be provided for vital structures. During the treatment, fluids are rushed back into the ruptured or degenerated discs, allowing the healing process to take place. The procedure is usually painless, can be done fully dressed, and is usually very effective in the treatment of acute or chronic spinal pain. Patients usually experience some relief of pain within 2 weeks of care. For even better results, Dr. Jakob combines both manual and computerized forms of spinal decompression therapy during each visit. This proves to be a 1-2 punch against pain, which seems to provide faster, more potent results.
For me, the management of patients with chronic low back pain is intellectually and emotionally a very challenging job. Low back pain is the second most common reason for office visit to a general internal medicine physician like me. Recently, I became more interested in non-invasive, non-surgical procedures just because the studies showed that 5 years prognosis for patients going for surgical versus non-surgical procedures are quite similar. And I'm very fortunate that in my building is Dr. Jakob, a chiropractor physician who is specializing in non-surgical, non-invasive, computerized spinal decompression. And some recent studies show that MRI before and after the treatment with this type of management showed a significant difference in the height of the vertebra and also in the space between the disc, which helps the nutrition and the circulation of the disc. Dr. Jakob helped a lot of my patients. They otherwise will end up with surgical procedures, multiple medications with multiple side effects and interactions, multiple injections.
As I mentioned, you graciously entrusted me with over 100 of your pain patients, and I appreciate that. Can you please tell our viewers what type of results a vast majority of these patients attained?
Well, I have sent you a different array of patients from the very acute to chronic pain. People who just had pain in the recent days and people who have been suffering from pain for a long time.
Right.
With the methods you're using, you have been helping my patients in an unbelievable way.
Thank you.
I have never seen results like that with anything else. My patients are very happy. I don't receive any callbacks because they're complaining of pain. And I know that after a few treatments, they are completely improved.
Doctor, let's backtrack for a moment. I'm sure you remember how you and I got started. Can you please tell our viewers that story?
Well, I remember a patient of mine who came maybe a couple of years ago who is a letter carrier for the Postal Service who had acute pain in her neck and her lower back.
Hello, my name is Yvonne Norton, and I'm a mail carrier. I was experiencing severe lower back and neck pain. It had gotten so bad that I could barely walk without limping, and lifting anything was virtually impossible.
I examined her, treated her with anti-inflammatory medication and muscle relaxants and combination of cold and heat. Came back a month later, I asked her how she was doing, and she tells me my pain is completely gone, but then she says, but I didn't take your medicines.
I remembered at that time that a new doctor had just moved in on my route. Each time I would go in to deliver his mail, I noticed a dry eraser board on the wall with a new testimony about how wonderful his treatment was. I became intrigued. I then asked him a few questions and made an appointment immediately. After one treatment, I felt relief almost instantly. I had no pain in my legs at all. My husband thought I was exaggerating until I started walking the dogs again, and shortly after I went back to the gym.
She asked you to be treated, and after 4 or 5 treatments, her pain was completely gone. Did not take any of my pills. I was intrigued, surprised, got your information, and I call you for the first time.
The most important thing I can do is to properly assess the patient and figure out the exact cause of their pain. I then appropriately match them up with the correct treatment protocol.
There were so many different options, and there's really no cookie cutter way that he does things. It's not the same thing for everybody and everyone gets better. He has different things that he does for different people for their specific need.
Mr. Michi, can you please tell our viewers what you felt like right before our first visit together? Were you nervous? Were you anxious? What were you feeling?
I do remember when pulling into your parking lot, and I was hoping, because I was in such pain getting out of the car, that you could help me get through this pain. I was very skeptical.